Hi everyone. I'm really excited about this case. I want to thank Kelly for sharing or allowing us to share her case. These are one of those individual cases that I absolutely love because it requires a lot of thought process regarding the reconstruction, and it's almost like putting pieces of a puzzle together. So let's take a look. So disregard this side of the picture just yet. I want you to focus in specifically right over here. And what Kelly's concern was after, what was the actual injury, Kelly?
A dog bite.
A dog bite, right. What kind of dog?
A dachshund.
A dachshund?
It's embarrassing.
Oh, come on. You gotta say it was at least like a German Shepherd.
I'm sorry. Dachshund.
Oh, all right, fine. It was a dachshund. But it was a very, very
Super aggressive.
Very aggressive dachshund. You know how aggressive they can be. Terrifying, I understand. Oh, yes, yes. And so if you take a look, I really enjoyed it. So if you take a look, what's going on with her upper lip? Number one, she's got this incision line or this scar running down here. She has the loss of the continuation of this red line, which is called the vermilion. There's less red lip show here than on the other side. There's a lot of red here, and then there's almost no red lip over here. And she is left with this big kind of scar up here that was really obvious in person, you know. And so when I met her a couple of weeks ago, I went over this and I made this drawing and I said, well, here's what's going on. You know, you've sort of lost this contour that exists, so I have to rebuild that. You don't have this red lip, so I'm going to have to reconstruct that. You've got this white patch over here that I need to remove. And there was also in this region, maybe you could see it right over here, there was an indent. So right on this lip portion over here, right over here, it should be sort of coming out a little bit. And she had this indent. So it was a lot of fun. We're putting together the video of her surgery. I want to thank her sister so much, who was, I think she was, what's a famous filmographer, or she was filming everything about this and photographs, videos. So we're really excited to put a production together, video together for you on YouTube. But it required multiple individual small little procedures where I took this red lip and I removed a portion of white lip here and then advanced the red lip, okay? That was separate from removing this white scar tissue and closing that, which was separate from filling in this little white area by taking some fat from her belly, very little fat. I know you wanted
more.
More to take out, but took a little bit of fat and filled in. And then at the same time, because when you raise up this red lip, it can become flat, and I don't want that. I want her to have this ridge that she had here, so I also filled this area in as well. Now, it's only been a week, we just took the sutures out, and so there is a little bit of swelling on the upper lip, but let's take a look at Kelly. Again, Kelly, thank you so much for agreeing, and I'm just going to wipe this little. But you can see how nicely we've got red lip where there was none before. We've got a nice continuation of the white red lip line. That scar here is no longer. These little red dots that you might see are simply because I just took the sutures out. And I was so excited about the result, I wanted to go live now and show it, even though the photographs in a week, 2 or 3 are going to look even better. But tell me how you're feeling. You really said some nice things, and I said, stop talking. I want you to share it with everyone else who's considering this kind of reconstruction. So how do you feel?
Was something I never thought was possible. It's been 10 years since I've had a lip. I haven't been able to feel my lip in 10 years, and I felt it for the first time a couple days ago, which was very exciting, and I can't stop staring at myself because I can't believe this is real, and I cannot thank you enough.
Oh, sure,
this was
sure.
A gift I never thought that I would have.
Yeah, we talked about this. You would come up to see me. She doesn't live in New York, so she traveled up here, and which is an inconvenience. And I remember you're like, look, is it possible? I've been living with this for around 10 years, and you can feel your lip better, and it is swollen, so it's going to get better, I promise. And the contour is going to look better and better as time goes on.
Yep.
Okay.
Dr. Miller's amazing.
We also talked about this, is that when she smiles, go ahead and give me a smile. This, oh wow, you know, it really is a lot better. But when she smiled before, it came down really low. So I was sort of anticipating, and it still may very well be that way, that in raising up that red lip, I pulled up like a hammock that area that was hanging down. But it may not ultimately be that way, which is fine, because I can just do a little lip reduction in that region and get rid of that too.
Yes, that's fine.
Okay? Oh, good.
Thank you,
You're a
thank you.
sweetheart. You're a sweetheart. All right. Excellent. This is Dr. Miller. Thanks so much for checking in. And we'll put together a whole video for you on YouTube and let you know when that's ready, sort of before and after in the video, and all the surgery as well. Terrific. Thank you so much. I really, really appreciate it. I really, really do. Thank you.